So my name is Cliff Lane. I'm the NIAID Deputy Director for Clinical Research and Special Projects. I have the honor and the pleasure to provide a few closing remarks on behalf of NIAID and Children's National Hospital. As noted by Dr. Batshaw in his opening remarks, this annual symposium celebrates a partnership between Children's National Hospital and the National Institute of Allergy and Infectious Diseases. Established in 2017, the Children's National NIAID partnership focuses on advancing the health of children with allergic, immunologic, and infectious diseases through collaborative research and education. It includes joint protocols, training, and conferences such as this one. First and foremost, I would like to thank all the moderators and speakers for what I think was an excellent set of talks and discussions. We have tried to strike a balance between the new initiatives related to COVID-19 and the important long-standing work going on in allergy immunology, with an emphasis this year on fundamental immunology and food allergy. While the current wave of COVID-19 in the US is on decline, with a most recent 7-day average of approximately 15,000 new cases per day, which is a 94% decrease from our peak of approximately 250,000 new cases per day in the US, it is important that we continue our research efforts in COVID-19 pathogenesis, treatment, prevention, and work to develop a better understanding of the long-term consequences of SARS-CoV-2 infection and the durability of protection conferred by the vaccines. As noted during the symposium, great progress has been made in our understanding of the biology of the immune system, with the ability to study things at the single cell level, to characterize the role of the microbiome in immunoregulation, and use the most recent knowledge of food allergy pathogenesis to develop novel therapies, as well as improve established therapies. We've tried our best to have a blend of speakers from a variety of backgrounds and at varying career stages, and look forward to receiving your feedback regarding topics and format for next year's meeting. In this regard, we will be sending out a post-conference survey to get your evaluation and recommendations. As you likely noted, the majority of the talks have been recorded, and those recordings will be posted on the CTSI Children's National website under the event page next week. In addition to the speakers and the moderators, there are many individuals behind the scenes who are critical to the success of this partnership, as well as the logistics for this virtual symposium. In this regard, I'd like to give a special thanks to Helen Kim, the Program Director for the NIAID Children's National Hospital Joint Program, and her team of Stephanie Norman, Christine Pang, and Annie Fulton. And thanks to Shadon Lloyd from Children's National Hospital Conference Services. We hope next year's symposium will be at least in part in person, and we will attempt to combine what we have learned regarding distance conferencing during the pandemic with returning to more traditional venues. In that regard, I'd like to congratulate Children's National Hospital with the opening of their new research facilities and conference center on the former campus of the Walter Reed Medical Center, and hope that might be a venue for a future symposium. I would also like to give a shout out to Dr. Kurt Newman, the president and CEO of Children's National Hospital, and his efforts in arranging to have Governor Northam participate as a keynote speaker. I'd also like to acknowledge the work of Dr. Lisa Guay-Woodford, the director of the Clinical and Translational Science Institute at Children's National, which serves as the host organization for the NIAID Children's Partnership. Lisa's endless energy, enthusiasm, and support have been critical to whatever success we achieve. On the NIAID side, I want to thank Dr. Gina Montalegre for her role as our primary point of contact and liaison and go-to person for anyone of a number of issues, both scientific and administrative. And finally, I'd like to offer a special thanks to Dr. Mark Batshaw, the physician-in-chief and chief academic officer of Children's National Hospital, for his steadfast leadership, not just of this symposium, but of the overall partnership with NIAID. When we first explored the possibility of embarking upon this journey, Mark set the tone in his typical, effective, non-assuming way by noting that there were many things to do in this type of partnership, but that the most important thing was that we never lose sight of why we are doing what we are doing, namely to bring health and well-being to all children, and that we should use that as the compass point for our journey. I think that sentiment came through very clearly during the symposium with remarks by the academic speakers, as well as those from Government Northam. Thank you again to everyone for your participation, and we look forward to welcoming you to next year's symposium.